Okay, so my name is Shelby Wright.
I'm Lizzie McMillan.
I'm Marissa Williamson.
And I'm Jenna Warren.
And we did our presentation on the rotavirus. And we did a poster board, so I'm going to bring that up real quick. Let you look at that. Okay. And Shelby's going to start us off.
Okay. To start off, we're going to start with history. And the rotavirus was first discovered in 1973, and it is known to be the cause of diarrhea disease. In the 18th century, diarrhea disease was responsible for 80% of the deaths of all children who were abandoned and left in farmland homes in Ireland. In the early 1900s, deaths in infants ranging from 6 to 18 months were 5,603 of every 100,000 in New York. In the late 1940s, 40 of every 70 admissions died per week in the UK due to this virus. After the vaccine was invented, numbers in the countries that were receiving the vaccine significantly decreased. However, in developing countries who still don't get the vaccine, those mortality and morbidity rates are still high. Like I said, it is the cause of diarrhea disease, and it is also responsible for 5 to 10% of all gastroenteritis cases. The illness is defined by diarrhea and intestinal and gastric inflammation, which, when left untreated, causes severe diarrhea and then can lead to dehydration and then death. Like I said before, the virus rates were really high in death. Up to 3 million infections per year were noted in the U.S. Almost every child was infected at least once before the age of 5. And before the vaccine, 400,000 doctor visits were due to this virus. Also, 200,000 ER visits, 70,000 hospitalizations, and up to 2 to 60 deaths each year in the U.S. Globally, over 453,000 deaths in children under 5 happened each year. After the vaccine, prevention for this illness was about 50,000. And like I said, after the vaccine, those numbers have significantly dropped. This disease can happen anywhere in the world and in all seasons, even fall and winter especially. Rates are highest in children who are 3 to 35 months old, and this increase doesn't start until 3 months due to possibly breastfeeding and then also passive mother antibodies that are still in the baby system. All ages can get it though. Those at the highest risk are those who are in daycares or who are hospitalized, and then any adult workers who are taking care of these children. Also, anyone who travels and anyone who is immunocompromised, such as anyone with HIV.
All right. The transmission of the rotavirus can happen to anyone, anywhere globally, and it can happen, like Shelby said, any season, but it has higher incidences in fall and winter. The virus is shed in the stool, and it also can be shed 2 days before your symptoms start and 10 days after is when it's transmitted. It is the fecal-oral route. So if a mom changes a baby's diaper and doesn't wash her hands, that can be transmitted that way, or if the child goes to the bathroom and doesn't wash his hands afterwards. It can also be transmitted through objects, droplets, and food and water. The symptoms of rotavirus are fever, vomiting, severe dehydration, abdominal pain, and diarrhea.
Okay, so now I will be doing the treatment. As Shelby said, a vaccine came out in 2006, and there are actually 2 options for that. There is Rototec and Rotavirix. Rototec comes in a schedule of rotation of 3, so the infant can get it at 2 months, 4 months, and 6 months, and that vaccine will be complete. And then Rotavirix comes in 2 rotations. So at 2 months and 4 months of age, vaccine will be complete. And obviously, hand washing and cleanliness is an issue, like Lizzie said, with the mother not washing her hands after changing a baby's diaper. So you have the vaccine and the hand washing, and Right. So under prognosis and treatment, typically the rotavirus only lasts a few days in individuals with healthy immune systems, and there is usually complete recovery. A complication is dehydration, which can be life-threatening if left untreated. There's no specific medication used, but preventing dehydration is one of the biggest concerns. And so oral rehydration, or in more severe cases, IV fluids are given. And nursing interventions include managing the diarrhea, assessing the skin, abdomen, and bowel sounds, monitoring the perineal skin, maintaining the normal fluid and electrolyte balance, and administering the prescribed medication.
Okay, and that is our presentation on the